Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over wound moisture or exudate. But first, if you could hit that subscribe button, it would be greatly appreciated, as it does help my channel reach more people, and that is what my channel is all about, is helping more people. So let's get started, guys. All right, so I get this question a lot, and I think people, where they're struggling is moisture balance. Okay, so moisture balance is super important for wound healing. You want a just moist wound, okay, kind of like your eyeball. That's how you want it. Now with moisture and exudate, once again, we need to look at what we're being given. Do we have a very wet wound? Is there a lot of exudate coming out of there? If there is, what do we need to do? We need to absorb that moisture because we want it just like our eyeball. Okay, so if it's too wet, if it's macerated, excoriated, we have too much moisture here, we need to absorb it. Okay. On the opposite side, though, if it's too dry, or we have that like eschar hard tissue, we want to add moisture. Okay, really simple here, guys. We want it to be a just moist wound. So what do we have to do? We're either going to absorb moisture or we're going to add moisture, one or the other, right? So moisture is an essential part for wound healing, okay? It maintains a moist wound environment, allowing the wound to heal, okay? It provides nutrients and white blood cells and promotes that wound to just heal, okay? So if it's too wet or too dry, that's not what we want, because it can break down the wound, not allow it to heal. We want just that moist wound, okay? That is best practice for wound care. Now, overall, the goal of exudate is to effectively donate moisture and contain it within the wound bed, okay? Too much exudate leads to maceration or breakdown of the skin tissue, where too little can result in the wound bed drying out, not allowing the wound to heal once again. Okay, so the different types of drainage that you might be seeing. Serous. This is just your yellow. This is normal. It's typical. What you see, it's just a clear, thin, watery drainage coming from the wound. Normal. Serosanguinous, it is a cleary, yellowy mixed with a tingy pink. Okay, so you have your serous and your sanguinous, which is your blood. Okay, so it's kind of mixed together on that one. Normally you see this in the inflammatory or proliferation phase of wound healing. Like I said, sanguinous is exudating blood. Okay. It can be associated with hypergranulation. Okay, when we get hypergranulation, it bleeds very easily. We then have purulent drainage. This contains pus. Okay, so it can be milky. It's normally a thicker drainage. The consistency can be gray, green, yellow. It is an indication of infection. Okay, now hemopurulent, this could be blood plus pus. Okay, that's often due to established infection, okay, when it's already there. But like I was saying earlier, it's pretty simple when we're just thinking about exudate here, okay? Nothing else, not infection, not anything else. Exudate, we are looking at it. Is it too wet? We need something more absorbent. Is it too dry? We need to donate moisture, okay? So I just thought I would add this because this shows absorbent cover dressings, okay? And it gives you a great idea. Now, I grabbed this out of my book. I do have a book available on Etsy. I believe it's linked in the description. If it's not, I'll add it there. But I grabbed this from there, and it goes over the least absorbent to the highest absorbent. Okay, so it's like, just determine where you are on the scale and pick your dressing. Okay. Now, sometimes we're adding something. So we have a dressing and then our cover dressing. So these would be our cover dressings here. But sometimes we do need a wound care product of some sort. Okay, so the hydrogel, this is donating moisture. Our non-contact layers, it's providing a layer, a non-stick layer. Okay, so this is really just keeping it at the moisture level that we're already at right here. Okay, now moderate, we have our hydrofibers and our gelling fibers. We have our foams, and then we go to our alginates, which have the highest absorption here. Okay, so you're literally just using these scales, you're seeing what you have, and then go to this. Okay, I know there's a ton of wound care products out there to choose from, but literally, if you're using your charts, if you're looking at this, okay, how much exudate do we have? It's telling you what to use. Okay, so we need to be using these resources. So I hope this video did give you a better idea of how to manage the drainage or exudate coming from the wound. But that's all I have for this video, guys, and I hope to catch you in the next one. Bye for now.